At our new breast center, your registration will be the same place that you come for your appointment. There'll be 3 people there ready to check you in with privacy. In the new space, we've added a separate breast waiting area for imaging. It includes an area for screening. If you're there for a short appointment, you go in that space and you stay in that space and you leave. And then if you're there for a workup or a diagnostic, you're placed in a separate waiting room. It's a little bit more private, and that's a little bit more decorated, and it'll be there with other patients that are there waiting a long time as well.
We will have a screener at the door when you come in order to do that initial temperature check and ask you some questions about if you've been exposed to COVID or anything like that.
The services that will be provided at the new Breast Care Center really encompass all of breast imaging with regards to mammography and ultrasound and imaging-guided biopsies. The only thing that the new Breast Center won't offer is MRI. Our current MRI facilities will remain as they've always been.
Also, we're combining services, so at this new location we'll have surgery oncology, survivorship, genetics, social work, hemonc, and also infusion just for breast patients.
We have 6 infusion beds at the new breast center, so all of our breast cancer patients will be treated literally next to us, within our proximity, under our eyes, watching them at all times. These infusion beds will serve to treat all of our breast cancer population, and they're really only for breast cancer patients. They will be for chemotherapy, but they will also be for hydration and for blood products and whatever our patients need.
Everyone will literally be in the same building. The quality of care, the ability for different teams to collaborate on a single patient within a single visit or treatment is immense.
There are times when we have patients that need imaging after their infusion, or need to meet with the breast surgeon after their infusions, and so now they'll be able to do that. Instead of going across the street or getting another appointment, they'll be able to come around the corner and they'll actually be able to see that provider.
At our current screening locations, which are Northridge and Zion's Crossroads, there'll be no change to those services. So patients can continue to get their screening mammograms at these locations if they choose. They'll continue to have access to 3D tomosynthesis, and all of their images will continue to be read by the breast imaging experts at UVA.
It's definitely a space that's very bright, that's very positive, and I think patients would really feel more relaxed in that space than they do in a multi-story building.
I think that the patients will be very happy and very excited to walk into the building with having new artwork and murals being painted. I think it's going to be a great experience for our patients.
Most important to me is that comfort, building that team that really starts having almost a family feel.